What are people saying about the Covid-19 vaccines? On social media, there is a lot of information circulating online, and false information is deeply hurting the vaccination efforts. This week on Health Watch, we debunk the myths surrounding Covid-19 vaccines. My name is Saada Hassan. 6th March, 1.02 million doses of the AstraZeneca Oxford vaccine arrived at Jomo Kenyatta International Airport through the COVAX facility. The consignment of 1.02 million doses was part of an initial allocation to Kenya of 3.56 million doses as per an advance purchase agreement between the Serum Institute of India, Gavi, and the Vaccine Alliance.
This is a fantastic moment. We are all very excited about this particular event, receiving the vaccine for the first time in our country. We've been fighting COVID-19, we've been fighting this virus, but we have been fighting it with rubber bullets. But this time round, what we have received here is equivalent, metaphorically speaking, to acquisition of machine guns, bazookas, and tanks to fight this war against COVID-19.
However, timelines that were set by the Ministry of Health for the arrival of the second batch failed to materialize due to a sudden surge in COVID-19 infections in India. And as a result, all countries that depended on the Serum Institute were affected. But even with the few doses that were availed to our country, a bigger threat faced the Ministry of Health. How to convince Kenyans to take up the vaccine, and why was the vaccine important? The innovation theory classifies people in a society into 5 groups: the innovators, early adopters, early majority, late majority, and laggards. Innovators are characterized by curiosity and ease in trying new things. Early adopters are visionaries and are willing to take risks to try new technologies or products to solve problems. Early majorities see practical solutions to solve problems, while late majority will take time to accept things until they see how the new products or technologies work out for the first groups. The laggards are just comfortable in their own zones and are not willing to change. Vaccines uptake here in Kenya can use the same theory to classify our behavior and levels of acceptance. About 5 months down the line since the first batch of vaccines arrived in the country, Kenyans appear not to know where they can get the vaccine.
I think our government is not doing enough. Sababu shida ya gava yetu ni ile wanasema that vaccine na wanatuambia that kuna shida na corona na wenyewe wafanyi enough. Because an example, wanasema watu wako vaccinated. Sisi wenyewe kama Wakenya hatujui tunakimbilia wapi kupata vaccine yenyewe. Kitu ya pili, shida gava yenyewe wanasema waliweka budget ya vaccines. Nao wenyewe hawataki kununua vaccines yenyewe, wanaongoja kupewa. Unaona? Sasa hiyo ndio shida mingi tuna face. Kuna kama ma up countries kuna place wanatafuta vaccine yenyewe na wapati.
One of the problems ni ati through social media tunaweza get information that the vaccine yes ni positive inawasaidia watu na through tumesaidiwa na WHO, lakini on the other side so unajua venye rumors you spread.
So far, about 5 batches of vaccines have arrived in the country. 1.02 million through the COVAX facility, 72,000 doses donations from South Sudan through the COVAX facility, 410,000 doses donations from UK through the COVAX facility, 250,000 doses donations from the government of Denmark, and 100,000 doses donations from the government of India. According to the Ministry of Health, the country is expecting more doses of vaccines, which include 1.76 million doses of Pfizer from United States of America, 235,000 doses from Greece, 55,000 from Latvia, and 13 million doses of Johnson & Johnson through the government's procurement. With all these efforts, there is a bigger problem that hinders the vaccination programs: vaccine myths and misinformation. Social media contributes largely to false information being shared and the ripple effect is the slow uptake of vaccines.
Hii vaccine watu vile wanaiongelelea, wengine kunao wanaongea kuhusu kweli kuihusu, na wengine wanaongelelea vitu zingine different. Kama sasa wanasema ukidunga ati ni kama umekuwa cyber, kama robot, ukienda mahali unafuatwa, huwezi jificha mahali popote juu umeshadungwa vaccine.
Nimebaki kwa lemon na other varieties, unaona. Lakini through the vaccine nimeona si mzuri juu ya venye kusema maybe unaweza kama udunge mtu na maybe alikuwa mgonjwa. Ukimongezea hiyo shindano unaweza pata ina affect, inakuja na side effects zake. Generally ukiangalia the old people, ukiongezea hiyo shindano hao ndio wenye wanaenda, si ndio? Na ina affect mostly the lungs. According to me, the vaccine, yes, it na help on the other side, but on the other side bado kuna venye na spread uoga kwa wananchi wenzangu.
Hiyo dawa mimi sijaipata, na watu wameongea mingi juu yake, na unajua hii mambo ya kusikia huwezi amini sana. Umesikia mara inapunguza uzazi, kitu kama hiyo, na unajua sasa lazima utumie ndio upate ile infection yake. Mimi sijaitumia na sijajua inapeana kwa hospitali gani.
Scientists say that so far there is no data that the COVID-19 vaccines may cause infertility and no credible scientific theories that back the narrative. The chair of the COVID-19 vaccination task force, Dr. Willis Ahwali, says that every vaccine faces a similar challenge and sensitization is the key to put an end to misinformation.
Misinformation is something that attended not only to COVID-19, it has also been there with other vaccines. For us, right from the beginning, we identified that as a challenge. We've done our best in terms of giving the right information. We have been, you've seen many of our members, Ministry of Health, really going out, coming to radios and TV stations. But we are going to scale this up. This second phase that began in July is going to involve the wider community, the wider population. Virtually everybody now will be eligible for vaccination, so we need to talk. Among our strategies, on top of the mainstream media, we are going to do sensitization meetings. We are going to work with county commissioners, the chiefs, and ensure that these messages reach the people. We are going to use opinion leaders within communities, religious leaders as well. So, and then in addition to that, we are going to have interactive forums so that we hear reasons as to why we identify that misinformation, and we strategically then come up with measures to counter.
Vaccines hesitancy is not only in Kenya but in other countries where national leaders fail to be on the front line to educate the masses about COVID-19, its effects, and the vaccine, now have a hard time convincing their nationals to take up the vaccine. Social media once again is flooding with false information that derails the process. Expiry dates have been of concern for vaccines as some donations come in late, and due to few resources, they delay reaching the intended regions.
When COVAX distributes or allocates vaccines, I think the primary determination is to ensure equity among countries based on agreements that have been reached on them. That's the kind of core principle of the COVAX. And then, of course, there's also a look at what countries have been able to absorb before being practical. We want to minimize countries having to redistribute vaccines that have been deployed to them, because that frankly spends more time and energy which could be used in the rollout of the vaccines themselves. Countries have done a lot of thinking and micro-planning to prepare for receiving the vaccines, and we have worked with partners like UNICEF and others to support this process. They've learned a lot as well from the first round of delivering doses of vaccines about some of the issues that I mentioned before, being as meticulous as possible about mobilizing additional capacity of people who will actually deliver the vaccines, vaccination sites, registering people who are going to be vaccinated, and then the logistics, supply chain, and even the financial resources, making sure that money reaches the people who have to deliver the vaccine and doesn't stay in the capital cities, as sometimes happens when we run campaigns. We are looking, and I don't have the details here, at expiry dates of some of the vaccines that are going to be delivered. We are particularly concerned that some of the donations may have very short timelines in terms of expiry dates, and this is something that needs our careful monitoring always. What we do is ensure that the countries have this information as they're receiving the vaccine, so that they structure the delivery in order to minimize vaccines reaching their expiry date before they're used. So this is something that we're very much aware of in our work with countries. But as Dr. Nkengasong was saying, we are now at this very encouraging phase after a bleak June of vaccines becoming available. We're working very hard to make sure that the capacity is ramped up, the partners provide the support so that every single dose can be translated into a person vaccinated.
We really appealed for anyone donating vaccines to the continent that they should be mindful of the expiring dates, and that way we do not end up with another issue and a different narrative on the continent that vaccines have been donated and they were not used, and because of the expiring date. If the vaccines come with very short expiring date, it will be difficult for the countries to absorb that. And then the narrative will be that the continent didn't use vaccines. I think we should avoid that kind of a narrative and make sure that we coordinate our efforts as much as possible, keep the communication lines open, and only make sure that we donate vaccines that will have at least a 3 months to 4 months shelf life. I think that is very important. Otherwise, we'll easily find ourselves into a very confusing scenario where the narrative can easily be misleading.
So far, about 2.5% of the adult population has been vaccinated in Kenya. Over 1.7 million Kenyans have received the first dose, while more than 670,000 have received their second jab. This translates to about 63% of the second jab uptake by those who received their first shot. Current data shows that the COVID curve is still rising, and this is similar across the African region. More than 200,000 COVID-19 cases have been confirmed, and the death toll is more than 3,000 cases. Vaccines offers effective ways of protecting one against harmful diseases. In this case, COVID-19 vaccine protects one from severe attack of its effects. If you have concerns about the vaccine, raise them to the right channels or follow the right social media pages. Sada Hassan for Health Watch, KTN News.